I'm Dr. Judy Bowie, a breast surgeon at Mayo Clinic. In this video, we'll cover the basics of breast cancer. What is it? Who gets it? The symptoms, diagnosis, and treatment. Whether you're looking for answers for yourself or someone you love, we're here to give you the best information available. Breast cancer is a relatively common type of cancer. In fact, it is the most common cancer worldwide and the most common cancer diagnosed in the US. Currently, nearly 4 million women in the US alone are diagnosed with breast cancer. However, this doesn't make a diagnosis easier, but it does mean a great deal of research and effort is being put towards ending it. And it's working. Survival rates continue to go up as treatments get better and more tailor-made to each patient. Just like any cancer, breast cancer results from DNA mutations that instruct your cells to grow out of control. In this case, it targets cells in the breast tissue. And there's no single thing that causes these DNA mutations. There are a wide set of risk factors. But having more of these risk factors can increase your chances of developing breast cancer. More than anything, your risk is increased by being female. That doesn't mean men don't get it. Actually, men account for about 1% of all cases. Another factor is age. The older you get, the more likely a breast cancer diagnosis becomes. A history of breast cancer increases your risk too. That includes your own personal history, if you've had it before, and your family history. If breast cancer is common in your family tree, you are likely at increased risk of developing it. Scientists have identified several genes that, if inherited, are more likely to cause breast cancer. There are many, but the most common and well-studied are BRCA1 and BRCA2. While they don't make breast cancer a certainty, your chances of developing it are much higher with these particular mutations. Beyond that, radiation exposure at any point in your life increases your risk of breast cancer. Things to keep an eye out for that might be signs include lumps or thickening in your breast, changes in the size or shape of your breast, changes in your breast skin, or a new inversion of your nipple, peeling, scaling, or flaking of the areola, and redness or pitting of the skin over your breast that looks kind of like an orange. Most importantly, because these things may or may not be cancer, be sure to check with your doctor if you notice any of these signs. If you suspect you might have breast cancer, how do you find out? Doctors use physical exams, mammograms, ultrasounds, MRIs, and needle biopsies to determine if cancer is present. If that's the case, you and your doctor will need to discuss treatment options. Like any other cancer, breast cancer requires a smart and strategic approach. Your treatment plan depends on what you're up against, namely the size and the stage of the cancer. What type is it? Is it sensitive to hormones? Many questions have to be answered before you and your care team can put a plan together. Surgery is not always the first step. Frequently, medical therapy, such as endocrine therapy or chemotherapy, will be recommended first to decrease the size of the tumor in the breast or decrease the disease in the lymph nodes, and importantly, to evaluate the response of the cancer to the treatment, as this can be critical information to guide further treatment after surgery.